Hi, I'm Dr. Berni, and we're going to talk a little bit about. Hi, I'm Dr. Berni, and some of you know me, some of you don't know me, whatever. I'm a homeopathic practitioner. I have an office clinic in Gilbert, Arizona, um, and it's called Gilbert Natural Medicine. And just so I can give you my website right now, it's gilbertnaturalmedicine.com. You could go there for all the information on what I do, all my presentations. You can see me on YouTube, where I produce different videos on different health topics. And my channel is Health and Wellness with Dr. Berni. So go there, learn stuff. Everything I go online with is free. So I'm teaching you things that you should be knowing about. A little earlier in the day, we talked about body worms. And so now we're going to maybe switch over a little bit to autoimmune disease, because I specialize in STDs, fibromyalgia, um, Lyme disease. So I do all the autoimmunes. Okay, and viruses. That's very big with me in my office, viruses and clearing everything up. Um, Now, a real tiny bit about body worms. Almost everyone has body worms. So, what you need to do is learn how to eradicate these little critters that are living inside of you, uh, feeding off of your tissue and your waste products. And so suddenly it's like, why am I always so hungry? I just got through eating. Why am I hungry? You're not getting any nutrients because those little critters are eating everything that you're putting in your mouth and swallowing. Where do they live? They live in the gut. Uh, but they're everywhere. I used to have a patient that would tell me, I've got these worms, and my doctor thinks I'm crazy. So when she brought me the worms to see them, they were dead, of course, in alcohol in a bottle. And I said, where'd you get these worms? Well, they come out of my ears. I said, yeah, okay, right. Well, I examined her and I looked at her eyes, like the doctor always does this and looks in your eye. Okay, I saw the worm crawling across her eyeball. No doubt she had them coming out of her ears, among other places. How do you see worms? In your stool? They come out dead. So don't be afraid. They're not going to be playing, swimming around in your toilet bowl. They're going to be dead in your stool. How do you recognize them? Okay, there are tapeworms, flatworms, roundworms, pinworms, all different kind of worms. Research it on the internet. You should know what they look like. Tapeworms will come out in segments, maybe this long, maybe this long. I don't know, whatever they decide to do, because tapeworms are this long. I mean, they're like feet and feet and feet long, and they break off in little segments, and then they just live, like little babies, floating around in there. And you need to get rid of these things. Now we have also parasites. We have good parasites. We have bad parasites. So we can get rid of the bad parasites because you don't need that in your body either. You don't want any inflammation. You don't want any critters. You don't want anything like that going on in your gut or any part of your body. You want to keep your body clean. So here's one way to do it. Don't eat any pork. Don't eat bacon. Loaded with worms. I don't care what they say. And don't have the butcher say, well, we get the pork, we get the pig, and we chop them up and we clean them up. And you could forget that. I've even seen worms in chicken. So they exist. They exist in animals. They exist in you. They exist in your dogs. Like what happens when you bring a little puppy home? You deworm them. First thing, you deworm them, then give them their shots. How do we deworm them? I have a product in my office I work with. It's called Paracom. You drink 30 drops of that in a quarter cup of juice before bed. You do it for a period of a month. In about a week, you're going to start seeing some things. You might think, gee, when did I eat bean sprouts? Because they look just like bean sprouts if they're tapeworms. And if you haven't eaten bean sprouts in 3 days, you have worms. So people with big bellies and they can't lose weight, it's not a weight problem, it's a worm problem. If you have a lot of gas, if you're irritable, if you're itchy, in different parts of your body. So many ways to detect worms. I don't want to get too deep into this right now. Um, But babies, okay, you have to watch infants. You have to watch little kids, toddlers. What's the first thing they do? They put everything in their mouth. So they're putting their hands in their mouth, they're putting their fingers in their mouth, and they have pinworms. Why do they have worms? Because everything they touch gets underneath their fingernails. How do you know it's not worm eggs? That's how they get them. They don't necessarily have to be in contact with another person to get pinworms. You can get them from the ground. So, how do they come out? They come out in the rectum at night when the child is inactive and is sleeping. And then they itch like crazy. And they actually come out, and maybe you don't see them in their stool because it's not what you're looking at. And maybe you see some little white things in there, but you could think maybe it's food or something, so you're not paying attention. So if you have this problem or you think you have, even if you don't think you have, it's a good idea to deworm yourself every 6 months. Um, Great idea to do that. So you definitely want to get a hold of me, gilbertnaturalmedicine.com, and call us at 480-703-0151 or 888-244-0888, and I will arrange to mail you the medicine because we're seeing everyone online right now, and we're mailing the medicine, like all other doctors, they're seeing many of their patients online. Eventually, I will allow you to come back into my clinic when I feel it's safe because we're about to embark on a new flu season. So, not safe yet, guys. Not safe yet. You're not going to know what flu you have. If you have COVID, if you have this strain, if you have that strain, good luck with your doctors who aren't going to know. It's going to be a hit and miss. So be careful this flu season. Remember, wash your hands constantly. Wear a mask. Very important to protect the next person. And the next person wears a mask to protect you. So it's a give and take thing. Don't laugh at the mask. The mask is so important. I don't care what kind of mask it is. It doesn't have to be an N95, although you can get them on the internet now. Wash your hands. Scrub your fingernails. Wash your palms like this. And do this for 60 seconds. They say 20 seconds, but 60 seconds. Get a good wash on those hands. And if you have to use a sanitizer, even better. Okay, let's move really quick over to fibromyalgia. So I have patients. They come in. I have fibromyalgia. My doctor said I have fibromyalgia. What is fibromyalgia? It's a bunch of symptoms that they throw in a hat and they say, scramble them all up. Oh, we have this new illness now. We're going to call it fibromyalgia. So what does the doctor do for it? I don't know, because unless you treat every individual symptom, you can't get rid of fibromyalgia. It affects the nerve endings. It makes your nerve endings very, very sensitive. And this is what fibromyalgia is. It's all about the nerve endings, the nervous system, the neuro part of your body. All the nerves in the body are affected so that you can't be touched because you hurt. You're very lethargic. You have headaches. You're just not yourself. You're sick all the time and you can't seem to get better. Doctor can't give you an antibiotic for that because an antibiotic is not going to take away all those symptoms. So in my office, we treat every symptom and that's how we knock it out. So you're thinking we're knocking out fibromyalgia. We're treating the nervous system. So it's almost like a virus, but it's not. But it stays a part of your nerves, and it plays havoc. All of those symptoms combined, many symptoms go into the word fibromyalgia, and we eradicate this by treating like with like in some of the symptoms. Um, if you're having trouble breathing because of fibromyalgia, we give you lung. If you're having a skin disease, a rash, or whatever because of fibromyalgia, which often happens, we treat that with skin and things like that. Causticum is a wonderful remedy for fibromyalgia. It gives you back your mobility so you don't have so much pain. I love treating Lyme disease. Now, let me tell you real quick before I end this video. People that have Lyme disease have been told over and over and over by their medical doctors that they cannot cure you. So what do they expect you to do? You're going to go home and die because Lyme disease, and I'm sorry for being so bold and abrupt, but that's just the way it is. If I don't tell you like it is, then you don't want to know me because that's what I'm all about. I don't pull any punches with my patients. They know exactly what's going on. And so they get smarter for that, right? Should I lie to them? No. Should I cover something up? No, absolutely not. Should I be stupid and dense? No. I'm going to tell you like it is. There is a cure for Lyme disease. I can't say the word cure. Oh, there goes the FDA again. But I can tell you that we can make you well. We can take that Lyme disease and we can blow it out of the box, take it out of your nervous system, and you're done. What is Lyme disease? You're bit by the deer tick. The deer tick emits a spirochete, which is a little curlicue, looks like a curlicue in your bloodstream. And that spirochete goes into you and produces little cocoons or cysts that have more spirochetes in them so that when that cyst gets big enough and it explodes, you got gajillions of spirochetes going on in your body. That's why it's so debilitating. It's so debilitating because it lives in your body and it makes you so sick. You're going to lose your hair. You're not going to be able to get out of bed. Your bones are going to hurt. Your muscles are going to deteriorate. It's a slow killer. If you do not get rid of Lyme disease and you don't get the right kind of help. And I really, honest to God, really believe that only homeopathy could do this because there are so many wonderful natural practitioners out there. Your naturopaths. I work with one at my clinic. I share a clinic with Dr. Q. But I'm going to tell you that when I treat Lyme disease, I treat it like with like. I get all of my remedies from London, France, or Germany because I trained in the UK. My professor, Dr. Cook, was the homeopath to the Queen Mother. I learned very well and got my PhD then in Hawaii in natural medicine so I could practice as a homeopath. Um, so now when I treat like with like, I get my medicines from London. I get it from my manufacturer out there. I actually give you the spirochete. It's called Borrelia burgdorferi. That's the name of the spirochete. That's the Lyme that causes the Lyme disease. Now, when I give you that spirochete, it's not live. It is the energy of that spirochete. It's what that spirochete was all about. But now it is it's transformed into energy. So when you put it under your tongue, mucous membranes, sublingual mucosa, floor of the mouth, that energy goes to the brain. The brain recognizes it as a spirochete. Oh my gosh, this is Lyme disease. Let's kill it off. And the body comes to its own defense. And that's pretty much how homeopathy works. It works every time. Now, I've treated lots of Lyme patients. Sometimes I can knock it out in 3 months. Sometimes it takes 3 years. But hey, it's better than the alternative, right? If you need help with Lyme disease, go to my website. If you need help with anything, go to my website, uh, www.gilbertnaturalmedicine.com. You can sign up for a 15-minute free consultation with me on Zoom, and we'll talk about your concerns. It doesn't have to be Lyme disease. It could be something completely different. It could be an STD. You better get rid of that. Let's get together. Let's talk as patient and practitioner, and let's see if we can get you some help going on, okay? I also have to mention that I have a course in natural medicine that if you take this course, you can not only treat yourself and your family, but if you take the extended course, you could treat others. So we send you a wonderful certificate, graduation, and you graduate the course, and everybody's happy. Okay, here's what it is. www.arizonaacademyfornaturalhealth.com. Go to that. We're almost completely prepared for you to join that course. All you have to do is sign up. Give me your email address. I'll send you more information. When it comes time to enroll, you could do that too. I have another couple of courses I offer. Sometimes we do them free, not very often. There's a 2-hour class. The price is $197. I'll tell you that up front. Very easy to join that one. Learn about that on my website. We also have a 4-module or 1-month course, and you could learn how to better prepare to help yourself stay well and get well along with your family members. Yeah, listen, you're right on top of the flu season once again. Learn how to be prepared. Learn how to take care of yourselves. You don't want to have to suffer again like COVID is doing to everyone. You want to make sure you can knock out any kind of flu strain, and we can knock out any flu strain. Can we knock out COVID? Wash your hands, stay your distance, wear your mask. This is Dr. Berni. Everything I have told you is just that simple. So at this point in time, I'm hoping to hear from you, and thank you for listening.